I want it. Okay, I'll show this. Yeah. Good evening, everybody. I hope I'm audible. Good evening. भोजन का नाम क्या है?
फिटनेस इनको बोलो माटो माटो में माटो में टू में
Am I audible? Good evening. Thank you, Ma to Mom. Thank you for inviting me. Very good evening to everybody. I hope I'm audible. If not, please send your message so we could increase the voice or I come nearer. Just few things. You all must be seeing me sitting in a very odd way. I'm sitting on a bouncing ball. I hope you all can see this. Right? So again, it's the start of fitness. You all must be surprised why I'm sitting on a physio ball. Please, whenever you will sit on a physio ball, it's not like sitting on a sofa or a chair. Every muscle, your gluteal muscle, your hamstring muscle, your back muscle, your abdominal muscles are working. So your core muscles are working, right? So even for your children, those who sit on a laptop or want to work on computers, so in a very simple way, ask them they're allowed to play on their computers or laptop sitting on a physio ball. So once they sit on a physio ball, so even if they are playing the games for 1 hour, the muscles are working. We are exercising our gluteal muscle, our back muscles, our hamstring muscle, and the abdominal muscle. So it's like an exerciser. So it's much better than sitting on a sofa or a chair. So that's the start of exercises. So maybe you have spent almost 1.5 months, 3 months at home, but see that a physio ball will help you for doing all your other activities. Then you can bounce it. So it's an exercise. Then you can balance yourself, taking one of your leg up, then the other leg up. Right? If you're straightening the leg, I just see. Just take your leg up like this. Hold it. Balance it. It's an exercise. Hold the other one. It's an exercise. Very good exercise for the abdomen and the core muscles. Coming to the topic as we are going, the question that first arises about mask. So we are very worried about the mask that we are using. So what is the right mask? What is the right mask? It's very simple. Any mask that you wear, you're using any mask, right? I would say just on a lighter, blow. On a lighter, blow. If the light goes off, your mask is not good, right? So what you do, you don't have to buy costly mask. That's a tissue paper. So just take a tissue paper, keep it on the inside part of your mask, right? And when you are holding the mask again, when you wear the mask, you see, I can't blow. So your mask becomes good. We have also made masks from socks. Simple socks, give it an edge. We cut the edges and we use it. It can be a mask. Or you can just put a dupatta around you. But you have to be careful your oxygen level, because when you are wearing a mask, you breathe out and the same we breathe out carbon dioxide. So the carbon dioxide remains. So it should, wherever you get an opportunity of an open air and you are alone, you don't need to. And how it is checked? We check it through an oximeter. Right? So whenever you're married, it should be more than 93-94% oxygen level will be there and your pulse will be shown. So you should have an oximeter at home. And of course, we have the thermometers, laser one. So we check it again. This should be below 100, right? So that you don't have temperature, especially when your maids are coming home or the people are supplying things at home. So you should have a thermometer to check it. And people close to you use the oximeter. Just you have to put your index finger inside on it, and it's going to show you your oxygen level, right? SpO2 level. It should be more than 93, 94, you are safe. But if it falls below 90, you really have to see your doctor. That's 96 now, right? So people wearing masks for a long time, the oxygen level drops. You have to be careful. Now, corona first 2 days, 3 days usually is at the throat level. So I prefer our grandmother's recipe, haldi doodh. Haldi doodh best is at night before you sleep. Hot milk with turmeric in it is good. In daytime, have at least 2 or 3 times adrak wali chai. Right, in your tea, put a little adrak wali chai. Rest of the day, if you can sip warm waters. So regular hot water, just one sip also will do the trick. Right. After that, it attacks the lungs. So there is something called a spirometer. Okay, you don't need to buy, but see when this is 2.5 liters. Most of the Indians don't even have 2 liters. Our females in India have less than 1.5 liters. So see, when we take a breath in, the lungs can take up to 4.5 liters or 5 liters of air. Right? So I want to tell you why we breathe. So when we breathe, the content in the air, only 20% is oxygen, right? 20.78% to be accurate, right? But if you are in Matharan, Lonavala or Mahabaleshwar, Panchgiri, that area, right, it goes up to 24%. So when we breathe in, our blood supplies all over our body, it rotates everywhere and then comes to the base of the lungs. So once it comes to the base of the lung, it's already impure, that it has come there. So we breathe, it hits the base of the lung, the oxygen is taken by the impure blood, it becomes pure, goes to the heart pumps it all over the body again, right? So very simple. Why we breathe? But our breathing has become shallow. So when we are breathing, it's this, right? But we want this. So preferably morning, if you can do deep breathing exercise. I'm going to show you only one exercise, which is very good for your lungs. So take a deep breath through your nose. When you come out, you have to come out with a hissing sound, right? Let's do it together. We take it in, right? We empty it. Again, you can take it in at least 8 to 10 times in the morning. Whenever you see fresh air, don't miss that opportunity. Please don't do it when you are sitting in a rickshaw or in the middle of the traffic light. Right? You will be taking in all the pollution. Whenever you see fresh air, do it. And please, those who are staying in AC rooms throughout, please understand, AC only gives 15% fresh air, 15%, right? 15%. The rest it recirculates. So sitting in the AC whole room, suppose morning your oxygen content was 20 in your room and whole night you have slept with it and morning there are 2 people in it or whatever. So the oxygen level will keep dropping. Why? Because 15% fresh air, 85% it will keep recycling, right? So you need fresh air also, right? And do your deep breathing not in an AC room, but open your window whenever you see fresh air, and the best is 1 hour, 1.5 hours before sunrise, right? So I always tell that people, okay, we should learn from animals. No animals in the world is sleeping 1.5 hours before sunrise. All the animals and birds are awake 1.5 hours before sunrise. Why? Because they know the value of ozone much better. They know the value of oxygen. And in all religions there is something linked that we should get up early morning, right? Because to breathe that ozone, to be fresh. And animals also, when they get up early morning in the jungle, they look for the water. They first want to go and drink up a lot of water. So please, when you get up, at least have a glass of warm water, minimum. A glass of warm water that is going to help you, right? we need to increase our vital capacity. Right now, very important. I'm assuming we're all going to get corona, right? So let's immune ourselves. It's like something your window. You are scared somebody will come from your window, right? If you are on the ground floor or first floor, but somebody can come in. What do? We put a grill outside. Why you put a grill outside? So that they can't come in. Similarly, for any, now we are not talking corona, tomorrow something else will come up, some other viruses will come up. So we need to immune ourselves. So what is good for immunity? I said grandmother's recipe, haldi doodh, then ginger tea, right? Or we call it adrak wali chai, 3-4 times a day. Hot water, sips of hot water. That's going to keep us good immunity. At least 2 oranges, 2 mosambi, or half a pineapple will increase our vitamin C, or 2 limbus, 2 lime. So if we are having 2 santras, 2 mosambis, or 2 limbus, or half a pineapple, whether we are going to have a fresh juice form or we are going to eat it, that's vitamin C, very important for any viral for your immunity. Then vitamin D. Vitamin D for vegetarian, it will come from drumstick, the senga that we call it. We put it in dal, sambar, you can make soup out of it. It's full of rich of vitamin D. They are very good for your bones, very good for your immunity, right? And those who are non-veg, they can have paya soup once in 10 days or once in a week. Even payas have very strong vitamin D. So we are going to have vitamin C, we are going to have vitamin D, right? Deep breathing. Right, this is all to increase our immunity, not to be attacked by any virus. So let's put it like any virus. Then very important to at least 3-4 times a day to lie on your stomach, right, for 10 minutes. Because the lobes of the lung, right, takes more air in that position and it gives you a healthier lungs. We would see the children usually often, when they are tired, come home, they lie on the stomach, they turn their knee, they bend their knee, and they are lying like this, right? I'll show you the position, which is, as a child, nobody has taught them, but it's in a built-in nature, and it works. But I'll show you one simple exercise which all of us, which should do it in the morning. From last 18 years, I do it. I read my newspaper in the morning like that. Now that newspapers are not coming in hard copy, I go on my mobile or I go on my laptop and read my newspaper in that position. So do whatever you want in that position. Take this position. It's going to be very good for your correction or unwinding. I call it unwinding of your body. 2, it's at present when with involvement of corona, very good for our lungs. Just look at me how I'm lying down. You can take a round pillow, bolster. If you don't have a bolster, take a normal pillow, bend it, right? Under your chest. The pillow comes under your chest. You can keep your arms like this, right? You can play with your mobile. You can play on your laptop. You can do a reading, whatever you want to read, right? Whatever you are doing, you can have a cup of tea, coffee, you can drink like that, you can be like this, you can be like this, right? And your hands can be down. You could be resting even like this. Now, you can put your leg up, any position. You can form a figure of 4, reverse, right? Idea is lying prone. This is one of the best positions. You can do it from 10 minutes to half an hour, twice a day. 10 minutes to half an hour, twice a day. You can talk on mobile. You're calling your friend, you're talking to your friend, take this position, right? You can be in this position. It's going to be helpful. I've shown you the physio ball, right? Only sitting on it. Only sitting on a physio ball, only sitting on it is an exercise. Right? Because you need to balance yourself. You will be totally focused. Whether you are on a laptop, whether you're working on a computer, whether you're watching a TV like this, you need to balance yourself. So your core muscles are getting strengthened. Right? So this is one of the best exercises. Buy it for your children. At least make them sit whatever half an hour, 1 hour a day that they can do on it. Um, what exercise that I showed you, lying down on the stomach with a pillow under the chest, it aligns your spine. It aligns your spine, right? All those are complaining of back problem because we are bending whole day forward. See, we get up in the morning, we brush, we are bending forward. Then we are cooking, eating, or making something, bending forward. Then we are eating, bending forward. We are driving, we are bending forward. We are watching TV or something, we are bending forward. We don't do anything to do extension of our back, to align our back. So this is the exercise. If you are doing it for half an hour morning and evening, nothing like it. Now many people complain of neck problem. Almost 80% of people have neck problem, knowingly or unknowingly. Knowingly or unknowingly. Just take a towel, keep it behind your neck, hold the towel in forward, and you have to push it back. See, you don't have to do this moment. You have to do chin tucks. So I'll show you sideways. Right, see this? Right, so take a towel, push it backward. Push it backward. No looking up. Push it back. See this? The dancers do it very well. The dancers. So hold a towel and you push it. It strengthens your neck muscle. The trapezius muscle get relieved, and definitely all your neck problems will go away. So lying on the stomach, and this takes care of your whole spine. It aligns your spine. There are a few more exercises. I showed you all the deep breathing for the lung. Taking the breath in with the hissing sound, bring it out. It will increase your vital capacity. There are a few more exercises for strengthening of upper extremity and lower extremity. I would just put it on to my staff. They would be doing that exercises. Sitting at home, there are band exercises. You can do it while watching television or talking to your children. You can keep doing the exercises. I'm open to your questions, sir. You don't need this.
Can you show pulse and everything?
Sure.
Okay. We're going to learn a few simple TheraBand exercises for shoulder strengthening, which anybody can do it at home as well. Okay, so the color of the band depends on the resistance. This is the least resistance what I'm using. What you need to do is, this is basic global shoulder strengthening exercises. So what you need to do is, you need to just hold the band in your hand. See, my arms are tucked to my side. And what I need to do is, I just need to pull my arms out. I hold it for 5 seconds. 1, 2, 3, 4, 5. And I get it back inside. Okay, so it's a very simple basic exercise. 1, 2, 3, 4, 5. And I get it back inside. Okay, so this is one of them. The second would be, I hold the band straight in front of me forward and I just pull the band outside. 1, 2, 3, 4, 5. I get it back inside. Okay, I put it out again. 1, 2, 3, 4, 5. I get it back inside. Okay, now this same thing I can do at multiple angles. I can go right up and I can do the same thing when I pull the band completely out. 1, 2, 3, 4, 5. Coming back inside. Again I pull it out. 1, 2, 3, 4, 5. Back inside. I do it at an angle of 0 degree as well. So this is my angle and I'm just pulling it outside. Hold it for 5 counts. 1, 2, 3, 4, 5. Come back. I pull it outside. 1, 2, 3, 4, 5. Okay. I have the whole angle variation as well. So I pull the band out. I maintain this pull and I go right up. Once I've reached the top angle, I'm going to hold it for 5 counts. 1, 2, 3, 4, 5. I maintain this pull. I come down. Once I've reached down, I release the pull. Okay. So the same thing. I pull. I maintain this pull and I go right up. 1, 2, 3, 4, 5. Maintain this pull, come down and relax. Okay, same thing I can do for my back extensor, the shoulder extensors. I just pull the band and I take my shoulders back. I hold it for 5, 1, 2, 3, 4, 5. Maintain this and relax. We go again, pull it outside, take it up, 1, 2, 3, 4, 5. Come back and relax. Okay. Now, once you've mastered with the double hand exercises, we can start on with the single hand exercises where you try to do the band with one hand. Okay. So again, very simple. I'm trying to strengthen one shoulder of mine. So I put the band below my feet. I stick it there. Okay. The band is in my one hand, and all I do is I'm going to pull this band right up. Okay. So can you see the movement with single hand strengthening? 1, 2, 3, 4, 5. So basically this is an alternative for a dumbbell. The advantage with a TheraBand is I can alter my resistance. So if I need to increase the resistance, I hold it closer. If I need to loosen it and make it easier, I can hold it much further and I can do a similar movement. Okay, so 1, 2, 3, 4, 5. The same thing what you could have done with a 1 kg dumbbell or a 2 kg dumbbell can be done with a TheraBand. Okay, same thing I go sideways for my abductors. 1, 2, 3, 4, 5. We come back down. We go up again. 1, 2, 3, 4, 5. Back down. Now the same thing, I go with the opposite hand. I go it slightly outside. So this is a diagonal movement what I'm doing. 1, 2, 3, 4, 5. I come back. I go again. 1, 2, 3, 4, 5. We come back. Okay. So the same thing you can repeat for both your shoulders. 1, 2, 3, 4, 5. Okay. There's something what we call as a bow and arrow exercise. So it's basically for your retractors. So what you can do is you hold the band in one hand. Okay. Keep it firm there. The other hand comes at 90 degrees of abduction. And you just retract the shoulders. Okay, so this is 1, 2, 3, 4, 5. You come back. Okay, so you can see a pure shoulder retraction what is happening. 1, 2, 3, 4, 5. You come back. We go again. 1, 2, 3, 4, 5. Back. Okay. We can do a similar thing for our rotators as well. You can strengthen your internal rotators. So what you do is you clip it behind again your feet and you place the band in one hand and you just pull it up. 1, 2, 3, 4, 5. You come back down. You go up again. 1, 2, 3, 4, 5. You come back down. You go up again. 1, 2, 3, 4, 5. Okay. So very simple, basic. You can do them with the TheraBand, with the dumbbell as well. Okay. Now this is, you hold the band firm in your hand. You keep one arm of yours static and you just move the other arm. Okay. 1, 2, 3, 4, 5. You come back. Okay. Make sure your movement is slow and controlled so you don't avoid any jerks out there. Okay. Same thing you do again. Keep one arm static. Go with the other arm. Make sure you're not doing any truncal movement. 1, 2, 3, 4, 5. You come back. Same thing you can repeat with your other arm. So now I go with this hand. 1, 2, 3, 4, 5. You come back. We go again. 1, 2, 3, 4, 5. Okay. A similar thing what you do with a dumbbell is you do the bicep strengthening. Now in this case, what you do with a TheraBand is you just put it in the feet, put it down in your leg, you hold the band, and how you would ideally do it with a dumbbell, you do the same thing. You take it up and you go down. In case you find this very easy, you can just shorten the length and you can do the same thing. You go up, you come down. you go up, you come down. Okay, so this is again a very simple bicep strengthening exercise which anybody can do with the dumbbell as well. Okay, the same thing you can do for the triceps as well. So you take it beneath your feet. Okay, the TheraBand comes here and I take it up straight. I come back down. I go up straight. I come back down. I go up straight. I come back down. So these are basic strengthening exercises which we could have done with a dumbbell as well. So the dumbbell does the same work for me where I can do my bicep strengthening, I can do my tricep strengthening. It is done with the TheraBand as well. The color coding changes according to the resistance. Beginners usually use a light resistance to medium resistance. But as you keep doing the exercises, you come to a strong resistance of the TheraBand.
The one question was, it is very difficult.
Back again. Ma to mom, thank you. I'm open to questions now.
It is very difficult to walk and run wearing a mask. What should we do?
I said when you're wearing a mask, see when we are from walking, we are running. So as we walk or run, our requirement for breathing increases, right? So we need more air. Our breathing pattern also becomes faster. So what happens with the mask? We are not going to get air as freely as we are getting it without the mask. So what happens? You will have to lower it down. You need to have, or you have to reduce the intensity of your running, right? And if people are not around you, because mask is for when if the distance is well kept when you're running, you don't require that mask. You can just pull it down and do your running exercises because the body requires more air, more oxygen.
The next question is household work going to be as a chore?
Everyone can see and hear you. Okay.
So doing household chores help. Will doing household chores help?
Yeah, any work. I feel if you're washing clothes, you're drying clothes, you are doing ironing, these are all calorie burning. What I want you to understand that 7,000 calories equal to 1 kg weight. So when we eat our one meal, maybe 1,500 calorie, maybe 1,200 calorie, what we eat. Our breakfast is 800 to 1,000 calories, especially if you're having parathas with omelette or something. But and whenever it becomes 7,000 calorie, it is 1 kg. So how you burn it? An exercise for 1 hour, maybe just 500 calorie. So your one meal, like your breakfast, should be burned by working out 45 minutes to 1 hour, right? So in Indian culture, we have one meal extra, especially the dinner. So dinner, if you are having it, have it as per Jain's, have it before sunset. Earlier you eat your dinner, better it is. Don't have dinner and go to sleep, right? Body gets confused how to digest it, right? And have a very good breakfast. So I, in simple terms, say have breakfast alone, so nobody disturbs you. Have lunch with your friends, so you share, and have dinner with your enemy, so that he or she does not allow you to eat.
Okay, the next question is, I have a neck pain problem. Should I use pillow or not while sleeping?
No. Sleeping, if you're sleeping on your side, the question is something to do with the neck problem, to use pillow or not to use pillow. So my request is this, when you're lying on your side, this cannot fall like this. Your neck cannot fall. It has to fill up. So usually people put the hand also under the pillow if the pillow is not used. You should have a normal pillow. There is nothing wrong. And there is no tailor-made pillow for your neck. Right, whichever is comfortable is your pillow. I showed you 2 exercises for neck problem: lying on your stomach, hand under your chin with a pillow under the chest. Second, I putting a towel and doing this chin tuck movement. Chin tuck with towel is going to help you if you do it twice a day. Next.
The next question is adrak wali chai with milk or without milk. Which one is better?
It depends. If you're vegan, you don't need milk. Lot of theories going on not to have dairy products because the cow gives milk only for the calf, not for the human being. But we fool the buffaloes and cow and have the milk. But many are healthier without milk and milk product. So you can have a chai, a light chai. I have imli chai. I just put imli in a pot of boiling water and it tastes like a tea for me. So I've started having only imli as chai.
The next question is from Alka. I feel pain in my left hip bone, especially while lying down. What is the reason? Have never had this type of pain before. Any exercise to relieve from this?
Ma'am, when we are talking about hip, it's a big thing. We really don't know. We need to see an X-ray. We need to examine you and find out whether it's really hip. When you say hip, it could be back also. There's an SI joint, sacroiliac joint positioning. You know, we do certain tests to find out whether your SI joints are together. They are in an aligned position. That also can give hip bone. The reason of hip bone, whether there is some osteoarthritis changes in your hip bone, you have not said your age, the movement that is painful. So it's very difficult to just on a single line saying you have a hip pain, what it is. And till we don't know what it is, it won't be right to show you that exercise. But you can call on a landline, you know, so maybe you could do a video call with us and then one of our staff examines you and it will help you.
Jyoti Agarwal is asking, lot of body ache I am facing these days. What are the best solutions?
Usually most of the Indians, more than 50% of the Indians have lack of vitamin D3 and B12. B12 usually takes care of the muscles and nerves and D3 takes care of the bones. So as I said earlier, having vitamin good B12 and D3, not only immunity, it helps out usually when we say yahan bhi dukta hai, wahan bhi dukta hai, you know, number of pain are usually only because of deficiency of vitamin D3, B12 and magnesium. Any one of it, all three of it. So next time you do a blood test, please, it's not in a usual blood test. You have to ask them to do your B12, D3 and magnesium.
So there are two questions combined, one from Tejal and the other one is from Gurvinder Kaur. Both of them are complaining of shoulder pain. Any remedy? Whereas Gurvinder adds that she's tried a lot of treatment like nerve block, under pain management and many more. And last year, one of the doctors diagnosed of fibromyalgia. Is there any way this shoulder pain should go?
Shoulder pain, when usually patient comes to us with a shoulder pain, usually we have to check the sugar level. So we say when your sugar rises, when you become or on the way to becoming a diabetic, the sugar first attacks the shoulder joint. This is one. So once it is ruled out, you are not diabetic, still you have a shoulder pain, then we have to go and find out. So it may be through MRI we come to know there are a lot of ligaments. Shoulder is well built with ligaments. Whether there is injury to any of that ligament or it's a tear. Suppose sometimes there is a supraspinatus ligament which tears off, and usually it happens in sports people. So then we have to see whether really a repair is available. We need to repair it through arthroscopy or give strengthening exercises so other ligaments and muscle takes over and it takes care of the shoulder joint. So, Gurvinder, what you are saying, you have taken injection also for the pain and all that. Usually, the injection effects last 3 months to 6 months. But if you have done that and the pain has come back, so we really require to see your, if you have done any MRI of your shoulder or your arthroscopy when you had done for your shoulder, the report on it.
Doctor, please advise something for migraine.
It's a very large subject, migraine. Right. So the causes could be, we usually say when you are doing of your neck movement, the first 3 vertebrae supplies the head. So if there are no movement in the vertebrae of your neck, upper neck, that could be the cause. The tightness of the muscles could be the cause. The causes are many. So you really need to be evaluated to find out under what cause you get migraine. Sometimes deficiency, maybe deficiency of magnesium, D3, B12 are also the causes.
Harsha Khanna is asking, I feel my left knee stiffens when I stand for long and also when I sleep. How can I lessen it?
We all require to do a knee exercises, and the knee exercise is tightening of quadriceps. If shown, I'll just ask my staff to show you. Just whenever you're lying down or sitting position, may tighten your quadricep muscle, count 5 and relax. You have to just tighten your quadricep muscles in lying down position, count 5, relax. I'll just show you the exercise. Okay. See there's a knee, right? So you can put a towel down, just put a towel down, push it down, push it. So the heel comes up. Push it, hold it there. 1, 2, 3, 4, 5, relax. Again push it, 1, 2, 3, 4. You can do number of times these exercises, right? So when you can do it even when you are lying, when you are watching TV, your back could be to the wall, but leg straight, push the knee down, count 5, relax. If you can do it for 10-15 minutes or twice a day, 10 minutes and 10 minutes, it will give you at least 50% release, because the quadricep muscles is in charge of the knee joint. More strength comes to the quadricep, better is your knee joint.
Facing pain on my hand joints due to too much of housework and no help.
I know. I would only say that all those who were used or maids working and had a helping hand at home, all are complaining about it. So I would only say that we need to get used to it. We don't know when everything will open up, but definitely I want to show 2 exercises for you. Take a newspaper and crumble it. Right? This increases the strength of your hand. Or you can dip a towel in water and crumble it, remove all the water, and it should hide in your fist. The towel, if you could hide in the fist, that's an exercise. You can do it 2-3 times and push a wall in all angles. Just take your hand against a wall, push it against the wall, right? If yeah, you can show it on. Yeah. Right, no, do it on the wall.
Do it on the wall only.
This is, yeah, fine. See, it's all angles you're pushing your hand. Elbow straight, push it against the wall. So once your elbow is fully extended, it's an exercise for the bicep, triceps, all the muscles. You'll feel better on that.
Doctor, what causes TMJ? My right side lower jaw has been hurting very badly, and a few of them are saying their migraine has increased during the lockdown.
TMJ is a very, very large subject, and I hope things improve and you could come to us. We could check your TMJ and show you the exercises and release the TMJ. That is temporomandibular joint. It can't be spoken on it. It's a very huge subject.
Okay. They are asking how can we contact you or come and consult you? They have their MRI reports and everything. So maybe we can get them.
Yeah, I think so. The details of Nanavati hospitals will be there. I'm full time at Nanavati. So whether you can do a video call, whether you are allowed to come, you are allowed to come to Nanavati. We work whole day. We work from start of Corona. We have been working. The numbers should be there on the screen somewhere. Nanavati allows video calls.
There are questions, but the time is up. They're asking about spondylitis. They're asking about twice dislocation.
Spondylitis is something like graying of hair. With time, as a gray hair, so there will be osteophytes at your neck level. It will be at your back level. I know swimming is not allowed now. Swimming pools are closed. But if you ask me if I have to do one exercise, I will only do swimming. I have never had swimmers as my patient. We have Otters Club. We have got Khar Gymkhana near us. But I never had any of the swimmer as my patient, whether for neck, back, anywhere. So if you can swim for 45 minutes to 1 hour every day, There is no exercise better than that, because in swimming, every muscle and joint works. Only request is after swimming, after you have swam for 45 minutes or 1 hour, next 1 hour, don't eat anything. You are allowed to have green tea, hot water, don't eat anything. So next 1 hour after swimming is what is burning, is your fat burning. It's a very good way to burn fat. So swim 1 hour, don't eat anything 1 hour. It's one of the best way to remain healthy.
Everybody's wishing you happy Doctor's Day. True warriors.
Thank you. And I wish most of y'all would be, if any Doctors Day, happy Doctor's Day. And please pray for us. At present, we are all the frontline warriors here. Our hospital has more than 145 positive cases of corona at Nanavati Hospital. So pray for all of us. And wishing you all, hope to see again. So Ma to Mom, thank you. Thank you for arranging this lecture, and God bless you all. Thank you, Tejal. I know Chirag very well, so Tejal, thanks a lot. Jyoti, you have been very active in organizing this. Thank you to Jyoti also. Thank you to Tejal also. God bless all of you all, and thank you.